Actor Chris Hemsworth revealed this month that he is taking time off from acting after learning that he has a genetic predisposition to Alzheimer's disease. The 39-year-old discovered his DNA contains 2 copies of what's known as the ApoE4 gene. It's considered a strong risk factor for developing Alzheimer's. I want to bring in now Dr. Dona Kim Murphey. She is a neurologist and co-founder of Prognosus US, a platform for early dementia screening, counseling, and caregiving. Thank you, Dr. Kim, for joining us. Let's just start off by explaining what the ApoE4 gene is and why it's associated with Alzheimer's disease. I also want to make a point of calming people down because I was reading 25% of Americans actually will screen positive for at least 1 copy. In the case of Hemsworth, he has 2 copies, 1 from both parents, and that is a much higher risk factor, I understand.
Yes, so ApoE4 is what we call a risk allele. It's a genetic predisposition to developing Alzheimer's disease. It appears that the risk actually depends on the race and ancestry of the person. So it's important to understand that, for instance, African Americans have higher incidence of this allele. It actually doesn't have the same impact for African Americans. It appears to be somewhat protective for African Americans. And so it's really important to understand those differences. I'm sorry, what else did you ask about?
Just a better understanding of the gene, and if you do discover that you have this genetic predisposition to Alzheimer's, I'm wondering what steps you can take to lower your risk of developing the disease.
Right. So some of the modifiable risk factors that we know to be very strongly impactful in reducing Alzheimer's disease is cardiovascular risk factors. So things like hypertension, high cholesterol, diabetes, obesity, also sleep, making sure that you get good sleep, making sure that you avoid any kind of brain injury. Also, physical and cognitive activity are highly protective as well. There are other risk factors, behavioral risk factors that can be modified that have a little bit less of an association with Alzheimer's disease, but still are considered to be risks, such as smoking and alcohol use, or excessive use, I should say, hearing loss, depression, air pollution even. And now we have some, I think, growing evidence that things like racism, discrimination, things that generate stress in people's lives that could also influence whether they have cardiovascular risk factors as well. Those things can also predispose folks to developing the disease.
So I'm still trying to understand, I guess, a little bit more about the benefits of early intervention, early screening, and because it sounds like a lot of the things that you're recommending are things we should be doing anyway. Get more sleep, be healthy, eat well, avoid stress. Does learning that you have this genetic predisposition help in terms of any of the advancements on drugs? I understand that there's some major news now. An 18-month study published yesterday found that there's an experimental Alzheimer's drug that actually slowed the rate of cognitive decline. Can you talk to us about that and potentially any adverse side effects? Do you think that being able to know that you have this potential greater risk for the disease combined with these new treatments might be a game changer?
Yeah, so that study is for lecanemab, which does show that there is an improvement on something called the Clinical Dementia Rating Scale, and that is a functional scale. So it does ask people questions about how their loved ones are doing at home. So if it's like an informant who's a caregiver who's answering these questions, it is talking about how, like, the utility of this from kind of a patient-centered lens and a caregiver-centered lens. And there was improvement in using this drug relative to a placebo group. The problem with this is that the scale is kind of coarse, first of all, on how it assesses for those functional improvements relative to placebo. And so it could be better, I think, in assessing for how impactful this drug intervention actually is in the lives of patients. And then the other issue is that the drug does have a significant number of people who had adverse side effects. And this was also true of the drug Aduhelm that was approved earlier this year, I believe, by the FDA. That drug similarly had things like asymptomatic brain bleed or ostensibly asymptomatic brain bleeds, which, that's kind of scary, right? Like to take a drug with the hope that it gives you some modest improvement in function, but then there's something else that could happen in the brain that could, actually undermine your cognitive function. So I think that it's really important for physicians to be very well educated about how to counsel our patients about their individual risks for these different things. And the other thing that's important to think about is whether this drug is going to be equitably accessible to people, right? Because again, there's disproportionate risk for African Americans to have this disease. Or I don't know that I mentioned that before, but this is true. And so it's important that when we are developing therapies, that they're accessible to all people.
So it sounds like there's a lot of progress that's being made, but it's still something that is elusive, and researchers and doctors like yourselves will continue to work on. Dr. Dona Kim Murphey, thank you.
Thank you.